Good morning, everyone. Good morning for me. I'm in California, and probably good evening for many of you who are in different parts of the world. My name is Igor Kutsenok. I'm a professor of psychiatry at the University of California, San Diego. I'm originally from Ukraine, although I left Ukraine many, many years ago. As a part of my duties at the university, I'm directing the International Technology Transfer Center, funded by the US State Department and the Colombo Plan. This is one of the 6 addiction technology transfer centers around the world, and this one happened to be in Ukraine, and it's operational since 2016. So we've been doing quite a lot of work, training people, building workforce in addiction medicine, and then the war happened. Right after the war started, we decided to significantly change our scope of work and do whatever we can to assist people in Ukraine relevant to their mental health, addiction problems, and many other behavioral problems related to the trauma of that magnitude. We are still, everything we do is in the context of addictive disorders, drug and alcohol and substance use, but definitely significantly beyond the typical addiction training center and technology transfer center. Now we are focusing a lot of attention to the trauma, military trauma, trauma in the refugees, trauma in children, trauma in women, and many other aspects of severe trauma of that size that is happening right now in Ukraine. Again, our primary function is not to treat trauma per se, but to help practitioners who are working with traumatized individuals to gain skills so they will provide them the best services possible. And trauma work is very tricky. People who have good intentions but don't have clinical skills can actually make things worse. So in order to build the skills, we decided to initiate a series of training webinars followed by supervision and implementation assistance. And today is the first one, and I'm very, very pleased to introduce Dr. Sonia Norman. Dr. Norman is a professor of psychiatry at UCSD at our Department of Psychiatry at the School of Medicine. And Dr. Sonia Norman is one of the world-class experts in addressing multiple aspects of trauma, combat trauma, coping skills, longitudinal treatment, research, skill acquisition, implementation support, and many, many other things. And I'm very pleased that Sonia found time, and she's quite busy. She found time to work with all of us, helping practitioners, helping all of you to gain some skills. This is not the last intervention by Dr. Norman. This is actually the beginning of a process of building skills. And please join me in welcoming Dr. Norman. And thank you, Sonia, for doing that, because what you're doing is of extreme importance, and you may help saving lives. Thank you, good luck, enjoy, and the questions will be at the end of the presentation. You will have time to ask questions. If there is no time to ask questions, email the questions and we'll make sure that the questions will be addressed. So, Sonia, go ahead.
Thank you. Thank you for having me. And in terms of my time, I can't think of anything more important I could be doing today than talking with all of you. Thank you for having me. So I'm going to talk about how to help clients, patients that you're seeing during this time of war. I'm going to use the stress first aid model, which is an evidence-informed, researched model, and I'm also going to share resources that I hope you find helpful. So,
sorry,
yes.
I can't see your slides at the moment.
Oh, you don't? Okay, hold on one sec. Let me try that again. Show Microsoft PowerPoint. Hold on, let me stop sharing and then try that again. That's strange. How is that?
It's not full screen, but we can see your the presentation.
Let me try again to make it full screen. One more time. Okay, and then how's that?
I'm afraid also the same. If it's possible to check which application you're sharing. There we go. Yes.
Oh, really? Okay, great. I don't know what I did, but I'm glad I did it. Okay, so again, we're going to talk about, here's the cover slide. I do want to thank Dr. Patricia Watson, who's one of the developers of the model that I'm going to be talking about today, and who kindly shared a lot of great information with me today. So risk factors for psychological stress, I'm sure you're seeing it every day. So some of this is pretty self-explanatory, but traumatic experiences, life-threatening events, intense and prolonged exposure to extremely stressful events, prolonged deprivation of basic human needs, food, housing, shelter, routine, having violence intentionally inflicted upon you, torture, human trafficking are some examples. Also, separation from loved ones, from your normal life, loss, grief, isolation, lack of access to resources, to safety, and having to make decisions that challenge your morals and values. Do I make this impossible choice or this impossible choice? Living through these kinds of situations and after these kinds of situations can lead to a great deal of psychological stress. So the model I'm going to focus on is the stress first aid model for helping people in very stressful traumatic situations. So this model was initially developed for people in professions where they're constantly exposed to stress and danger. So people in the military, people who work in fire and rescue and in certain healthcare situations. And it's based on supportive actions that have been shown to help people come out of those kinds of situations in good psychological health or with better ability to recover. And this version that I'm going to talk about today is adapted specifically for people in contexts like war, where they're just facing extreme ongoing adversity. And I want to make it clear that this model is very much for people who are in the traumatic situation. If we were talking today more about refugees or people who had gotten to safety, the model would be a little bit different because their lives would be very disrupted, but they would be objectively safe, and we'd be talking about something a little different. Or if we were talking, a while from now and the war was over, people were safe, but they still had those psychological after effects like post-traumatic stress disorder, we'd be having a different talk. The talk today is really how to help people who are still in the danger, in the stress. So the stress first aid model consists of 5 main features and 2 additional features that happen all the time. So check is when we check in with the person in front of us about what they need, and we do that every time. Coordinate on the bottom left is what additional resources does this person need? What can we connect them with to help them today? So those we're always doing. And then the 5 features of the model are cover, safety. How can I move this person toward having a psychological sense of safety? Calming. What can I do to help this person become more calm, feel more calm? Connect. How can I help them feel more connection, more social support? Competence and self-efficacy. How can I help them gain or refresh skills that will help them feel like they can get through this? And confidence and hope. How can I help them have more confidence, a sense of meaning, a sense of hope, even in this incredibly difficult time? So I'm going to go over all of these elements in more detail. But in the background, some of the core features of the stress first aid model to always keep in mind with any interaction, regardless of which part of the model you're focusing on, is that rapport is foundational. Rapport is the relationship that you have with the person that is in front of you. So how to build kind of a positive relationship so that they feel that you are safe, that you are someone they can trust, that you are a trustworthy source of information. That the way you apply this model, it's not you doing something to someone else, but it's a very supportive, collaborative model based on conversations and exploration. That timing and context are crucial. So if you see someone today and see the same person next week, what's happening in the war in their town may have changed, what's happening in their life may have changed, they may have lost someone, there's just the way they're feeling may have changed. So that context is very important, and we're always checking in. But this model is all about flexibility and tiny steps and meeting people where they are. We know that you can't take someone who's in the middle of a war zone and make them feel safe and great, but you can take small steps to help them toward those goals of feeling a little safer, a little calmer, a little better. And that's what this model is focused on. This model is also very much about what not to do. As Igor mentioned, sometimes it can feel very overwhelming to try to help someone who's going through something so difficult. And sometimes our instincts, we just don't know what to do. And so in this model, we actually lay out some of the things that may seem helpful, but actually aren't helpful. So for example, we want to have a conversation and not so much say, okay, what happened to you? Tell me all the details. What do you need? What do you need? What do you need? Which might, the person may not know what they need, and it might kind of make them anxious and overwhelmed. So in this model, again, we focus on just the present and conversationally exploring what could be helpful to them. And we'll talk about how to kind of use this conversational style to understand their priorities, their needs, what their goals are, what they feel they need to be helpful. We don't press people on their past experiences. We do know from research that doing that when they're not ready is not helpful and can actually make them feel worse. But if the person does want to share with you about their past experiences or their traumatic experiences, and they start talking about it, then we want to make sure that either you have the time and capacity to listen, or that you help them identify someone or a time when they can share that, if that's something that they want to do. And again, stress first aid will not solve everyone's problems in a situation where that's impossible, but the idea is to help them cope better, have hope, feel safer, and get to a better place. So let's start with check, which again, we do all the time, every time you see someone. And the goal of check is to understand, how do I best serve the person who's with me right now, which might be different than what they need, might be different than the person I saw yesterday or an hour ago or the next person I see. So it's about collecting information and understanding that the situation is changing so fast and people's situations and reactions are changing so fast that every time you see someone, this check is critical. And it's about assessing their priorities. So you too maybe are also in danger, also having your own reactions. And so it's important to remember that this person's priorities may not be the same as yours, and to come in with a really open mind, really listen to what they need, what would be helpful to them. And people will have all sorts of reactions. Many will feel very out of control. Some will have a lot of anxiety. Some will have a great deal of grief if they've lost people. They may be worried. They may blame themselves for something that happened, that they should have done this or that instead. They may have intrusive thoughts where they can't stop thinking about some of these things that happen. They may be having very physical reactions in their body, fatigue, stomach ache, feeling sick, feeling nauseous. A lot of people in these kinds of situations go numb, and they say they can't access any feelings. They may feel guilt about something that happened. They may have anger. They may be withdrawing from all their social supports. So again, you want to suss out by some conversation what's happening with this person. And rather than just saying again, what do you need? How are you? Tell me how you are. What's going on with you? We don't want to press for too much detail, but we want to ask and ask some follow-up questions and really stay calm and kind of let them share what they need to share. We don't need to press for a great amount of detail if they don't want to share it. And we don't need to try to be optimistic and say, don't worry, everything will work out fine, things will be okay. Sometimes when someone's in a lot of pain in front of us, it's very tempting to try to just say, it's okay, things will be okay. If they really don't know that, and if the situation, we really don't know that, that doesn't ring true and it doesn't help people feel better. So it's best just to listen, show empathy, be supportive, and not make things more positive than they really are. And if they do want to talk, if you're able to, then let them talk and listen. Really, if there's one thing that's really key here, it's respect and empathy, that you are conveying those, and we'll continue to come back to those and just show all the different ways that your respect and your empathy are really going to be helpful to this person. Also remember that often in these situations, people are being so hard on themselves. It's so hard to be in an out of control situation. In some ways, to feel a little in control, we blame ourselves, right? At least then I can say I did something, that's my fault, rather than just feeling like the world is so uncontrollable. And if people had to make hard decisions about leaving or staying or fighting or not fighting, they can be suffering so much, even though there was no right choice. There was no, this was just an impossible situation. They can be being very hard on themselves. So for you to model, I accept you, I'm not judging you, I'm just listening, I'm just here to help, that can be very helpful to them as a model for how they can be kinder to themselves in this time. So follow the person's lead. If possible, don't interrupt, let them get it out, convey no expectations or judgment, focus on the present, don't push them to talk about the bad things that happened or, their traumas or the past. Be reflective, be supportive, So I understand that you're feeling very anxious today. I'm sorry that you've been through such hard things. Those are a couple of example statements. Clarify concerns. An example of that might be, let me make sure I understand what's worrying you most right now is this. Collect enough information to understand their crucial needs. Again, you don't need a lot of detail, but you need to understand what their immediate needs are. And again, repeat this process as needed. So let's get into the model now. We'll talk about cover and safety first. And one thing I want to say is, in some treatments, like let's say we were doing a cognitive behavioral therapy, it would be step 1 and then step 2 and then step 3. There's a process from start to finish. There's an order. That's not the case here. You check in and you realize this person feels very unsafe today. Let's focus on safety and calm. And next time, maybe you focus on safety and confidence and hope. It's a very fluid model where you can use these skills to meet the needs of the person today. So even though I'm going over these in order, you don't have to do these in this order. You do these in the way that makes sense. So the goal of cover is to move people closer to a sense of safety. Again, given the situation, you likely won't make them feel safe. That's maybe not possible, but you can move them toward a little bit toward a psychological sense of safety. And one step with that is actually to help people feel safe with you. So we talked about that, coming at them with respect and empathy. So, again, be open-minded, learn their names, use their names, demonstrate respect in how you talk with them, let them know what the rules of confidentiality are. Will you be keeping what they said to yourself? Are there things you need to share? Are there times you would need to report something, so that they know what the rules are? They can feel safe around that. Convey that you are here to help them. That might seem obvious to you, but it might not be obvious to them. So if you can say, I am here today to understand what you need, to help you as I'm able, or we're here to help you as we're able. And that here, you're safe right now here with us. Those are important things that may not be obvious. And understand that not everyone will have the same reaction. Some will have had more trauma exposure, more loss. They may be more sensitive emotionally based on other things they've experienced, based on their physiology. Some people will be very sad, some angry, some confused. Ask what their concerns are. Some questions you can say is, what helps you feel safe now? Is it certain people? Is there any person that when you're with them, you feel a little safer? Does it help you to distract yourself sometimes and think about something else? Is there some self-talk you're saying that's kind of making you more anxious and worse that we could look at? What helps you? Does spirituality help you? Going to church or connecting somehow? Are there certain exposures you can avoid that would help you feel safer? So for example, watching the news around the clock, or being in a place where injured people are being brought in constantly. Maybe if people could cut down the time they do that, if they're able to, that might help them feel safer. And information is one of the most powerful tools we have. So to the extent that you could give them simple, accurate information that's useful to them, that can really help them move toward feeling a sense of safety too. Even if the information isn't, it is realistic and shows danger, having accurate information is better than that. And resources are critical. So anything you know of that might be helpful to them, any resources, share those. So now let's talk about calm. And the goal here is to move people closer to feeling calm, because even in the most extreme situations, how we're responding, there can be a lot of variability. So again, when someone's truly in danger or displaced or has recent losses, they're not going to feel perfectly calm, but you can move them toward a place where they can feel more effective, where they can feel a little bit more in control. So one of the ways you can do this is by modeling it. So it's very important that you present calmly, that your voice is calm, that your body language is as relaxed as possible. Again, they'll read off of you and respond to that. And being with a calm person can be very calming. We want to validate people's experiences. So, things like, oh, it's not so bad, or, oh, no, that's not, you're fine. Those aren't helpful. Those actually they sound like calming statements, but they spin people up more into feeling not calm. But validating people's experiences, saying this has been so hard for you, wow, you've been through a lot, those kinds of things actually help a person feel understood and calmer. And reassure them that you will do your best to help. They'll understand that you can't fix everything, obviously, but reassure them that you are here to do what you can. And you can make simple calming statements like, I'm sorry you're going through this, and we're here to do what we can to help you. You can ask, what is calming for you? At other times in your life, what has helped you when you felt anxious or scared or just had a lot going on? What is calming for you? Focus on the present, what's practical and possible. Take possible actions. Help them to figure out what they can do even in this situation. And we'll go through some options in a minute, and help them set small goals of things they can do. Again, resources, knowing that there's some resources, and be accurate. Again, sometimes it's tempting to say like, oh, this great thing is coming, or, something that's a little exaggerated that you think will help calm them. But once they realize that it was an exaggeration or not accurate, that actually has the opposite effect. Then they feel they can't trust you. They don't know what's going on. They feel more out of control. So even if the news isn't good, being accurate is very important. And we have the option of doing things if the person in front of you is very agitated right in the moment. We have some skills like breathing skills, grounding skills that we'll go over. So things that aren't recommended for calming Again, giving inaccurate information, which ultimately undermines your credibility and is counterproductive. Trying to get people to process what they've been through and talk about their traumas. Again, we've learned that that's not helpful and can actually make people feel worse. And using things that seem like they might calm you, like alcohol or benzodiazepines. Those might have a short-term calming effect, but actually increase risk for more negative coping, more mental health problems, more depression, anxiety, post-traumatic stress down the road. So we don't want to encourage that kind of negative coping. We can help people practice their breathing, and that's some, calming breathing, and that's something we could do with them, where we have them take in a full breath, through their abdomen and through their chest, and then slowly exhale. Having that exhale be, 4 or 5 counts slower than the inhale. That slows our system. That really, introduces some calm to the body. So we could practice that with them, and encourage, if they find it helpful, encourage them to practice it on their own. It's a skill they can use anytime. Ask them if they have any other relaxation techniques that they found helpful in the past that they might use now. There's certainly many apps and things that can help walk them through that. And I'll talk with you about some later, including ones in Ukrainian. So we could also help, one thing that some people find helpful is writing. So take about 30 minutes and write everything that's going on with you, and then put it aside. Don't worry about grammar, don't worry about spelling, but do write with on paper. It seems more helpful than writing on a computer, we found in research. Just let it all out, and then say, okay, I've worried, I've put it all on paper. I'll do this again tomorrow, but now I can put it aside for a little bit. They can try that. Some people find that helpful. Some people aren't writers, but drawing or talking into a voice recorder might be helpful to them. Again, everyone's different, so you just want to feel out what might be helpful to the person who's with you. And you can help them make a plan. So for example, right now they might feel okay with you, or maybe not, but they're going to leave, and the stress is going to continue, and they're going to get, bad news, and their minds are going to go to bad places. And so you could say to them, what can you do when that starts happening, when you start getting reminders of your trauma or feeling really out of control? And you can make a plan with them, like what's helpful to you. Is it the breathing? Is it reaching out to someone? Is it saying a prayer? Explore with them. And so then they can leave and say, okay, when I start feeling that really out of control feeling, I can try X. And that feels a little calming and gives them a little bit of a sense of control. You also may encounter people who are extremely angry. Maybe they're angry right now with you, or maybe in general, they're just saying, I feel angry all the time. And so you can suggest some strategies for them, like, distracting themselves when they feel themselves getting angry. Take a break, leave the situation if they can, help someone with something. Maybe they can step back and say, okay, what's happening here? Why, take someone else's point of view. Maybe they could talk it through with someone else who could be a sounding board. Maybe they just need to separate themselves from a while from those triggers or the people that are making them angry. Maybe they need to ask for help, and you can help them make a plan of what that could look like. And then, of course, a lot of people might be experiencing grief. I know in my own practice, I get referrals sometimes from another, I get referrals to someone in mental health from someone in another area of medicine who say, this person cried, so something's wrong, so help them. But sometimes people cry, right? And that's okay, and that's the normal reaction. And it doesn't mean, they need a higher level of care. So, try to take into account, is this person crying because they're really sad and that's okay? Is that culturally appropriate? Do they really need more help, or do they need to let those feelings out with you? You know, when someone's lost someone, we often feel like we don't know what to say, and it's okay. They don't need you to say anything, but just listening and sitting with them and saying, I'm here for you, and saying, you know, I empathize with what you're going through. You don't have to try to make a grieving person feel better. Grief is normal and they need to go through that process. Just be there to support them. And when I remind myself of that, I feel kind of a weight lift, like, okay, I don't have to fix this for this person. I don't have to make them feel better. My intervention is my empathy, is my respect, is being there with them. And that is actually very powerful. If they want to talk about the loss, listen and provide support. If they don't, that's okay too. We can offer them some options, resources for support. Again, be genuine, be reliable, be sensitive to the things that might affect them, and continue to check in. Sometimes someone will be with you and you're thinking, okay, this normal stuff that we've just talked about is not enough to calm them. Their emotions are so big and out of control. Their physical reactions are so big, or maybe they're kind of frantic and can't calm down, or they're glassy-eyed and vacant, they're dissociating, they're not responding to you at all, or they're disoriented. In these kinds of situations, grounding techniques might be helpful. Probably many of you are familiar with these, but briefly, when you're doing grounding with someone, you kind of orient them to the present with different senses. So you might say, okay, feel the chair that you're sitting in, feel it under your body, touch it with your hands, or look at this vase I have in my office. Just focus on it. It's here now. Describe it to yourself in your mind. You could tell them to listen and look at you, you know, kind of just really get focused in the present. You can walk them through a few minutes of talking through everything that's in wherever you're meeting with them, your office or wherever it is. You can have them do that while they breathe slowly. You can have them name some things that they see that or hear or feel that aren't distressing. Like, I see your desk, I see your, you know, sweater. It just kind of brings them back to the present. This is very helpful when people are dissociative or really, really out of control. For younger children, colors might be helpful. And when possible, you can certainly get a medical consultation, although I understand that may not always be possible right now. So let's move on to Connect. And Connect is really around social support. And social support is part of this model because we have just decades of research showing that feeling supported, feeling connected is one of the most protective factors against future mental health difficulties. It's helpful for helping people feel that they can cope. So this social support connection, it just has so many benefits. But of course, not all kinds of social support are possible in all situations. So again, being flexible and dealing with the reality of the person who's with you are critical. But your goal here is to understand what kind of support is realistic and how you can help connect them to it. Remember that when they're with you, you are a source of social support. So again, these different parts of the model, they overlap some. And so again, being gentle and non-judgmental is part of it. And you want to consider their losses. If they've just lost a spouse, a child, others that were core social support, you want to be gentle around that and kind of take that into account for how you talk with them about building the social support in their life. So again, gathering information is critical. What's possible? What would be most helpful for you? This may change over time, so you want to keep checking in. Are they doing something that gets in their own way? Are they isolating? Are they coming at people with so much anger or something that's kind of pushing people away? Let them talk and listen and try to understand how you can help them build better social support. And what's realistic? What are some small goals? And these may need to be adjusted over time based on what's happening. Are there specific people that that the connection is helpful? Can they reach out to them? For some people, just helping others, are there ways they can volunteer or do something to help others? That could feel very connected and helpful. Or for some people, maybe it's just that they put themselves in a situation where they interact with others. And that's the social support. They're not just sitting at home by themselves all day. So maybe these are people they don't even know, but just being in a situation where they're around others interacting can be helpful. So let's talk about competence and self-efficacy. The reason that this is part of the model is because when people feel like they have skills to handle a situation or the ability to handle it, they do better. And even in situations where people feel very out of control, where very little is in their control, if there's small things that they feel like, okay, I can do this, and it leads to this, it can be helpful. So your goal is to understand, what does the person in front of you think would be most helpful to them? What skills might they need? What resources? And if you're seeing them over time and you see that they're doing some more of those things, validate that. Say, wow, I see that you've been doing this, and I see that you feel more confident in this area. The tricky thing here is we don't want to push people toward growth. We want to support the growth they're doing on their own. So if we say, okay, you need to gain these skills and you need to do more of this, and you need to, feel more confident here, that just can make people feel worse. But if we observe and we support and we say, I see you're working toward this, here's some resources to help you, or I see you've made some steps here, how is that for you? It's so great to see. Then we're supporting their path. And again, we don't want to be too sunny and suggest that they can control things they can't control or anything like that. They will just feel misunderstood then. Part of this is understanding what are their biggest challenges and needs. What information do they need about resources? Even though resources are outside of them, having access to resources and information can help people feel more competent. And remind them that things will change from day to day too. That something may be helpful one day and not helpful another. We want people to have realistic expectations, because when their expectations are unreasonable, and they don't come to be, then it's easy to feel incompetent and overwhelmed. Again, this is about connecting to resources, connecting to people that help them feel like they can get through this. It's all about taking very small steps, but being aware, okay, I did this, I took this small step. It's a small step, but it's something, and I did it. It's about finding some stability and routine, even in a time of danger and chaos, because that's something you might be able to feel in control of, even getting up at the same time each day or accomplishing some small thing each day. And so for some people, drawing from spiritual beliefs or cultural traditions can help them feel a sense of strength. They can ask themselves each day, what do I need to do? What am I able to do? That's critical, right? What am I able to do? And is it working? And so encouraging them to ask themselves those questions can help them take actions that help them feel competent rather than feel overwhelmed and feel incompetent. You want to help them really simplify and break things down. A big goal might be too much, but what are some very small steps toward that goal that you can actually accomplish even in these circumstances right now? And you want to help them be kind to themselves. I couldn't accomplish this, I failed, I can't do anything. People can be so hard on themselves, even in these impossible situations. So you want to help them find compassion for themselves, be patient with themselves, feel good about even those very small steps. And again, you're modeling that. How you talk to them about this will give them a model how they can talk to themselves about this. It might be helpful to go over a very concrete way to problem solve. They can, that often starts with understanding what's in your control and what's out of your control. I find that with my own clients, once I help them do that and they realize certain things that they've been putting so much energy into are actually completely out of their control, that they really, it takes a big weight off. So helping people even see what they can do and what's just beyond them right now can be very helpful. And then if there is a problem they want to tackle and they feel like they can make some progress there, help them generate some ideas of what that can look like, help them select a course of action that's realistic, help them make a plan with very small steps so they can, after each step, feel like they accomplished something, and help them figure out what skills they already have that can help them in the situation. You also want to look for negative coping, which is so common in these kinds of, extreme, stressful, traumatic situations. People might isolate or withdraw. They might pull away from loved ones, hide in their room in their house. They might avoid thinking about, anything related to what's going on. They might throw themselves into their work so they have time for nothing else. They might hide behind anger or violence. We find that anger sometimes feels like a safer emotion than pain, grief, some of the other emotions that are really driving how they're feeling. Or they might be using alcohol and drugs. And we know that all of these things are risk factors for future mental health problems and lead people to feel less confident and worse in the immediate time as well. So we want to foster positive coping, social support, distracting activities, if they're positive, like reading a book, watching a funny show for a little bit. We need that balance. Even in the most stressful times, we need that balance to cope with the stress. Setting and achieving goals, making realistic expectations, using those breathing exercises, exercising, getting help, using humor. And what we know from other times that people have been through such situations, that some things that help with competence are seeking information, diverting attention from dwelling on the worst of it, but reframing, using humor, acceptance, considering the actual threat in the moment rather than this generalized sense of I'm under threat all the time. Shift expectations to what a good day is to match the reality rather than the times before. Shift priorities to match the current situation. Create routines that are reasonable and helpful. Proceed with what's possible in life. Maintain faith in God if that is something that's helpful to the person. And maintain, this kind of finding those moments of love for life when possible. Nothing helps people feel confident like some sleep, which can be very hard in these situations. But boy, a good night's sleep goes a long, long way. So to the extent that people can sleep regular hours, not drink before bed, not have caffeine in the afternoons, get some exercise, do something a little relaxing before bedtime, whether it's breathing or reading, not take long naps because that can disrupt nighttime sleep, and get help if needed for sleep. That can be helpful. And, if someone is using alcohol and drugs, again, I know I'm preaching to the choir for many here, but that's something we always want to assess and talk about with people and, really explain how it may feel helpful in the short term, but why it really isn't, and really not just leave them with nothing, but help them find alternative coping skills that can be helpful. So the last part of the model is helping people have a sense of hope. And we know that when people have faith or hope, they tend to do better in difficult times. Again, we want to approach with respect and dignity, no judgment, and we want to correct inaccurate information. So people have, the facts so they can really assess the situation. We want to address unhelpful, very hopeless thinking and focus on help people focus on what they can do. Stay focused on what's possible, small steps. Again, this sounds similar to some of the other parts of the model, but they're all fluid and overlap with each other. Validate the things that they've done and help them in even small ways live according to their values or their spirituality, or do their things that give them a break. Maybe, you know, in life they really value, you know, the kind of parent they are, the kind of work they do, how they are to animals, their role in the community. What are some very small ways that they could do things today that enact those values that can help them feel a sense of confidence and hope? And we don't want to push people toward hope. We want to help them find it. So finally, coordinate is all about resources. We don't have all the answers. Not any one of us does. We know that. But to the extent we can keep track of resources that are available, and there's always new resources popping up. If there's someone on your team who could be in charge of that, or all of you, help people know what's available to them that might be helpful. It could be mental health resources. It can be practical resources. And what people need will change. So continue to check in. You know, just here's some examples of some resources that might be helpful. Especially, I think one question you might have if you're not a mental health provider is, when do I refer? So if someone's really not sleeping at all, if they're confused, disoriented, dissociating, are they so distressed that they can't function normally? They can't care for themselves or their children? Are they reporting that they're losing control over their behavior and behaving in unpredictable or destructive ways? Are they threatening to harm themselves or others? Absolutely, this needs immediate attention. Are they reporting more drug and alcohol use than usual? Do they have chronic conditions that they're not getting the right help for in this time? Are they just having very severe mental health problems, symptoms? Are they the victims of violence or abuse? So those are some specifics for when it might be good to refer people for mental health. So just be sure you know what the resources are. Make sure that they're helpful resources to the extent that you can, that they're legitimate. If they have life-threatening needs or injuries, you know, that's urgent. And offer support as the person takes steps. Help them take these steps as you can. So to summarize, this is a flexible model. Not all parts will be relevant. Maybe, you know, you see someone today and you're like, oh no, we're not touching hope today. That's not appropriate, but we're touching safety. Make that assessment, and then, you know, continue to make that assessment each time. In terms of some resources, the National Center for PTSD and the Center for Deployment Psychology have manuals for stress first aid, so you can download them for free. You can see, I don't believe we have these in Ukrainian yet, but that might be in the works. But at this time, at least you can get the resources, and there's slides and other things. There's some other manuals and related kind of resources also. PFA is psychological first aid. It's close to stress first aid, which we talked about today, but it's immediately after a disaster or a violent event. So someone is safe now, they're out of the danger, but they still feel like they're in danger. They're displaced, they've lost, you know, their normal routine, maybe they're grieving, and this is a model to help them. So this might be appropriate for some of you working with refugees or others who've you know, gotten out of Ukraine. And so we have resources for this as well, including actually an app that has been translated into Ukrainian. And a lot of stress first aid, which we talked about today, and psychological first aid, there's a lot of overlap. So I would say have people download this app. There's a lot of stuff for calming and safety and planning that they might have helpful. I highly recommend that they download the app and that you do, and get to know it so you can use it and help people use it. Here's some additional resources that you can have with these slides, and I will stop there. So let me stop sharing and we can take some questions. Oh,
well,
perfect.
Sonia, Sonia, thanks a lot. Do you hear me?
Yes.
Yeah. I think it's time for questions, comments. So let's open the floor. I guess it will be in chat. Am I right, Olivia?
There should be in your control panel a questions section where you can open that and you'll see the list of messages.
Yeah, I see that. Oh, it's even in Ukrainian.
Well, then you will definitely need to read those to me.
Yeah, sure. These are instructions.
That's the chat box. A little bit above the chat, there should be a segment or a section in the control panel called questions.
Let me find it.
And Olivia, you had asked about sharing the slides with attendees. That's absolutely fine.
Great, thank you so much.
Can you read the question? It will save time while I'm looking for the place.
Sure.
I can do that. And Igor, I've just emailed you the questions as well. Hi everyone. Sorry to jump in, but I just know it's easier because I've been following the questions, so I thought I would. I've just emailed them to you as well, Igor. But I can go with the first one. So it's quite a long point from one of our participants who said that for some who are grieving and at a total loss, they're reaching out to be given hope that the turmoil will come to an end. So the participant was a bit surprised to hear that the role is not to make the person feel better, just to listen and offer support. But they're asking that for others who are at the brink, do they need more from the person they have turned to? You know, they don't want to feel like they're talking to a wall or a rock, but they're just asking because some traumatized individuals need more than just a listening ear. They might need to feel there's hope for a better future where their pain will decrease over time.
Yeah, I think hopeful statements that are realistic are 100% fine. What I meant to convey is that we don't want to say things that we have no control over. Like, I don't want to say to someone, don't worry, the war will end soon. Everything will be fine. I don't know that. I don't control that. And so we want to avoid statements that are sort of these pat positive statements that are easy to say, but if they don't ring true to the person, they don't have a positive effect. They don't build trust with you. So absolutely say things that you believe, but don't say things just to help someone feel better that you really don't know if they're true or not.
Yeah, so there's a fine line of making sure that it's believable and relatable to the individual.
Yes, yes.
Okay.
Otherwise, it's just alienating.
Okay, thank you. Another question that came in asked whether trauma can change a person's personality and cognitive abilities.
That's a really great question. You know, some of the common symptoms of post-traumatic stress disorder are trouble concentrating, trouble sleeping, and of course, those make it seem like someone's cognitively impaired, cognitively different. And of course, some people's trauma involves an injury where there's actually a head injury and they might have some traumatic brain injury after. So it's those two, trauma and traumatic brain injury, can go together quite often. So it's certainly possible, but we do find that, you know, after the fact, if people need treatment for post-traumatic stress disorder or depression, in many, many cases, those cognitive kind of changes do get better with treatment once they're sleeping better, once they're concentrating better. In terms of personality, I guess yes, you know, because someone who is social might not want to see anyone. Someone who is happy-go-lucky might be angry, withdrawn. But again, you know, we do have very effective treatments for post-traumatic stress disorder and depression. Those aren't for right now, they're for later. But those do help someone rediscover those parts of their personality.
So it's not, you know, there may be changes, they're not necessarily permanent changes. You're talking about things that are reversed, you know, with work.
Yeah, I would say really those are symptoms, but they seem like personality changes. So many times I hear from a spouse of someone who returned from war, like he came back, she came back a totally different person. But we find that, those are actually symptoms of their traumatic stress, and those do get better with treatment, and they start to enjoy doing things again, and they start to laugh again, and, we can get those things back.
Yeah, okay, thank you. Another question, and I think I've still got time for this. How do you help the therapist be in the best mental state to help their clients in a time of war, or where they themselves have the same fears and anxieties?
That's such an important question, and we might consider doing a talk just on that in this series, because our own self-care and helping care for our colleagues at this time, it's so critical. We can't help others when we're feeling completely out of control and anxious and overwhelmed with emotion ourselves. And so that self-care is so important. And so everything I talked about today, you could apply to yourself and your colleagues. But you do have to check in with yourself, and you do have to, be honest with yourself about what you're capable of. And I think too, it's hard when you're experiencing the same thing as your client to sometimes put your own reaction aside and really tune into them, really hear them. And because their reaction might be completely different from yours, and they may be saying some things that are hurtful and offensive to you. They might believe something that's very hard for you to sit with and hear. And so you have to either be able to really be present for them, or you have to say, okay, what this person is expressing is so opposed, so painful to me, I can't help them, and help them find someone who can.
Okay, thank you very much. A last question. When do we need to provide an examination or an analysis to look at the long-term trauma consequences?
I mean, I don't know how possible it is with what's going on in Ukraine right now, but I don't think it's ever too early to start following people. I mean, and generally we find that somewhere, that a lot of people, no one is unchanged by an experience like this, but that a lot of people recover enough that they're okay, but there's always some portion of people who need help. I think in other wars and such, we've seen, throw out 20%, but it's really variable. So I think it's never too early. To diagnose post-traumatic stress disorder, we just need a month after the trauma. But again, when people are still in the context of war, it's hard to know how much natural recovery they'll have once they're actually safe.
Okay, thank you.
Yeah, I see it. Is there any medication for PTSD patients?
Yeah, we have the recommendation, the medications that are recommended for PTSD the most are SSRIs, and venlafaxine. So sertraline, paroxetine, venlafaxine are the ones that are indicated for PTSD. I would absolutely avoid benzodiazepines at all costs. They're highly effective and over time make PTSD worse. And I know sometimes people are tempted to treat the anger and such with like antipsychotics. The evidence really isn't there, and the side effect profile is really bad. So I would stick with those first line ones at first.
If they're not available in certain parts of Ukraine, is there any more conventional medications like beta blockers, hypertension medication, propranolol, that I've heard might be some effectiveness in these patients?
Yeah, those can help maybe with the shorter term anxiety. We don't have, the evidence base isn't there for them as long-term treatments for PTSD, but I think if you're treating someone who right now is highly anxious and distressed, those seem, I'm not a psychiatrist, so I'm talking from the research, from the literature, but I think that what you might consider with someone who's in that traumatic context might be different than what you used later on down the road to treat PTSD.
Do we have any more questions?
I'm happy to take questions after over email or whatever would be helpful.
Well, let me say first, Sonia, thank you so much. This was wonderful. And my friends from from the ISSUP, Joanna and Olivia. You're very, very helpful as always, and you're very good in what you're doing. For the participants, I just want to remind you, this is the first of a series of webinars, practice-based, skill-based webinars, not just research presentations, on addressing trauma. There will be a lot of similar webinars specific to different traumatized populations, and for different settings, for primary health care, for paraprofessional settings, for professionals building their skills. So this is just the beginning of this process. So you will be informed through the ISSUP, the schedule and the next thematics. We also planning a series of clinical supervision and case reviews, something that we call it implementation assistance. So now you got a little bit of knowledge. Please go ahead, try how it works. And then we will have sessions on case reviews focused on what difficulties you might have had with implementing those skills and how we can avoid mistakes and make ourselves more effective. So this is the beginning of a long process of training and technical assistance for all of you. And in the meantime, take good care of yourself, take good care of each other. Every crisis in the world is temporary. There is no permanent crisis. So this crisis is temporary too. It will stop, it will end, it will get converted into something else. But this particular massive crisis will have an end, and hopefully it will happen soon. And in the meantime, don't forget to take good care of yourself.
Thank you for having me.
Thank you very much.
Thanks a lot, everybody.